Please find your seat. The program will begin shortly. Please take your seats. The program will begin momentarily. The program is about to begin.
Second, perfect. Yep, right there, perfect.
How's it going?
Good to see you.
Good to go. Hi, everybody. Good afternoon. Hope everybody had a great lunch. And welcome to the Convenience Revolution, Designing Care That Fits Real Life. We have the perfect set of panelists for this discussion, so thank you for joining. I'm going to have them all introduce themselves, and we have a lot to cover, so I'm going to dive right in. But please, Dorothy.
Hi, I'm Dorothy Kilroy, and I'm the Chief Commercial Officer at Aura Ring.
I'm Jennifer Mazer, and I'm a Senior Vice President of U.S. Consumer Services and U.S. Lilly Direct at Eli Lilly and Company.
And I'm Wara Yogu. I'm a partner at the investment firm Thrive Capital.
And I'm Vin Gupta. I'm your moderator. I wanted to first start off, and Jen and then Dor, if you could really take the lead here. We had a big announcement between these two iconic brands yesterday that is directly related to the topic of this session. So Jen, could you talk us through what you announced yesterday?
Yeah, thank you. So yesterday, Lilly and Aura announced a collaboration that is helping people basically get access to a free sizing ring kit through Lilly Direct. No purchase of medicine is necessary to access this. But I think it speaks to the opportunity for a pharmaceutical manufacturer. We've been making medicines for 150 years. We announced our 150th birthday just recently, and partnering with an innovative company like Aura in the digital health space to go beyond the traditional healthcare ecosystem and help consumers really connect to not just medicine and quality care, but also tools and data that can really help them along their consumer journey and getting better health.
Yeah, we have seen a lot of our members starting to tag GLP-1s in the Aura experience, and we saw this growing trend for the last few years. And they really wanted insights into what was happening in their physiology. Getting a prescription and a medication is just one step, but actually understanding what's changing in your physiology and having sort of agency over that yourself is what we found. And so we're just so excited about the opportunity to actually bring that to members and let them understand more what's happening in their physiology. One member story I was sharing with Jen earlier today was a member who's struggling with an autoimmune condition. And she was just thrilled to see this partnership because the recent feature that we've launched around GLP-1 Insights gives her that ability to actually see what's going on in her body related to inflammation on the autoimmune condition that's affecting her sleep, it's affecting her heart rate, it's affecting lots of different parts of her physiology. And so this partnership starts to allow us to bring that to life.
That's awesome. Thank you both. Laura, I want to bring you in. Clinician, investor, entrepreneur at Amazon. Bring this all together. When did healthcare need connectivity, not just better products?
Well, you forgot model, actor, dad. We're friends, so I paid him to say good things about me. Great to be around, exactly. So I think in a lot of ways, right, it used to be, to your point, that convenience in healthcare was controversial, right? So I remember when we were at Amazon, that was the big thing, was we're working back from the consumer. We're going to launch a pharmacy that is sort of consumer first. My firm, Thrive Capital, we launched a health insurance company, Oscar, 14 years ago. And Oscar's big innovation was that we are going to be sort of consumer first. We're going to focus on the customer, making sure they had a great experience. And that was a radical idea, 12 years ago with Oscar. It was a radical idea. Kind of, 6 years ago we started the journey of Amazon Health with Amazon Pharmacy. I think it shows how far we've come. That now, I think in a lot of ways, and both your companies have been at the forefront of that. We have Lilly, a pharmaceutical company, who's out here saying, like, yes, the consumer experience is a big part of what we want to do. It's not just the medication. It's how do you experience kind of getting it? What is your experience while you're on it? How do we kind of have healthcare fit into your life versus what we used to do, which was make your life have to fit into healthcare. I think it's the same with, we have great companies like Oura. I have one. My wife has one. Actually, my wife has two. Right? And it's, we have super companies who are also leaning in deeper and saying, yes, we have this angle of understanding consumers, right? We fit in their lives, and we're going to help walk them and support them throughout that journey. So it's an amazing thing how far we've come, that now, an amazing consumer experience is kind of table stakes. And a lot of that comes from the expectations that consumers and patients have had that have made all the rest of us raise the bar on the experience we bring people.
And yet we have so far to go still.
Yes.
Yeah.
I did want to say early on, we're going to encourage audience participation early. So if you have questions, please just signal to me through a raised hand or just wink at me. We're going to divide this up into 3 parts. And this first part is, why is healthcare still so hard? Recognizing you guys are working to combat that challenge. Or I want to stick with you first, and then Jen, then Dor. Why has it taken so long for convenience to be the central thesis in healthcare?
I think so. A big part of it is, financial incentives, right? So in a lot of healthcare, the person who receives a service is not the person who pays for the service. We have this principal agent problem, and because of that, when people are building a service and you're building a business, you often focus on the person who is paying for it rather than the person who's receiving it. I think that disconnect is a lot of the reason why it's been so hard for people to build for convenience, is because we have a hard time navigating our end user and our sort of payer, and therefore you see that so many of our systems, we build around the person who's paying for it. We build around the employer, we build around the insurer, or we build around the person kind of delivering the care. Most of our healthcare system is arranged around the doctor, kind of the doctor's convenience. And I think those are kind of the structural forces that I think have made it harder for us to build in healthcare around the consumer than it has for our friends in media or retail.
Yeah, I think it's a really great point. And I would say the biology of health is very complex in of it itself. What works for you may not work for you, even though technically on a piece of paper you might share the same clinical diagnosis. So healthcare alone, that's overall health, is very complex. I think the ecosystem that surrounds it, you make a really great point. The ecosystem should ultimately serve the consumer, the patient that it was intended to exist for. And you have all of the stakeholders within the ecosystem, and the evolution and the innovations that have occurred in the ecosystem, aside from scientific innovation, is largely for every stakeholder except for the consumer. And then probably a close second, their healthcare provider. And so the consumer and the HCP is left to navigate this complex, fragmented healthcare system. And patients at the end of the day are, again, health is hard enough. Finding the right doctor, getting the right diagnosis, identifying the right medicine that's right for me. And there's no guarantee that that's going to work, right? And there's a benefit risk profile with every medication that's on market. But then to have to jump through so many hoops, and I always say, get a PhD in the US healthcare system to understand how to navigate it, we basically have placed that burden on the consumer. It's highly regulated. It's personal health information. There are reasons why it, I think, should be regarded with very high quality and care. But we're really, that's why I say I love that you think that we have made a lot of, I think, strides in convenience, but I think there's so much more that we can do. And just when we did the self-pay channel 18 months ago, basically with their GLP-1, it's crazy to me now that seemed like such an innovative model. You were prescribed a medicine, here's a transparent price, and you get the medicine at the transparent price. That's crazy, but that was such an innovation when it came to market. So I think it's going to require more and more of those innovations, and it's going to require the healthcare stakeholders, instead of pointing fingers at each other for whose fault it is, to really come together and create an ecosystem, again, with the patient at the center.
I love that theme of the patient as the center. We talk a lot at Aura about making sure that our members are the CEO of their own health. that they have agency, they have the data at their fingertips to understand what to do, and that they actually are informed and taking action themselves on the next steps. You know, most healthcare today is very reactive. It's in these isolated moments, right? It's a doctor's appointment to a diagnosis, to a prescription, maybe back to a doctor's appointment. And to me, healthcare happens every day. And I think it's 200 different decisions we make on food that we eat every day. Thousands of decisions on, you know, should I get up? Should I walk to that meeting? Should I take an Uber? I took the Uber today. I probably should have walked. I was running late. Should I go to bed on time? Should I drink that glass of alcohol? Like, all of those decisions are impacting your long-term health, and we don't have very good ways to understand how those decisions help. And so I think for a long time, we sort of waited for a once a year, if you're lucky, snapshot appointment, measuring a bunch of different variables. But that doctor's not with you every day making those decisions. And so it's making sure that the member is actually empowered with their own data to see what are the changes that I'm doing in my lifestyle that are working and that add up to that, and then have a more informed discussion with their clinician about what's changed over time and being informed on those trends in that data.
Dora, I'm going to stick with you. You mentioned, and I'm going to bring it up, I hope it's okay that I'm going to bring it up, and when we were chatting before the panel, that engagement with the Aura app was highest at 9 p.m. on a Saturday. Do I have that right?
Yeah.
One, talk to us about key learnings,
yeah.
what you've learned, what your company has learned, and then the gap between awareness and action. And before I throw it to you, I'm curious how many people own a Ring or a wrist-based device? Oh, wow. Okay, should we ask how many people own an Aura Ring?
Sure.
I'm curious.
Oh,
okay,
there you go.
all
Fun.
right.
I did give Dora advice that I was golfing this weekend, and I haven't adjusted my golf swing to the Aura Ring, so I took it out, and it still stayed.
Well, our new ring could help you with that. But
yeah, exactly.
I'm actually more curious. Is anyone seeing an increase in their heart rate at altitude? Yeah, poorer sleep scores. Yeah, it's interesting, right? And by the way, that's the reaction to that is very unique. It's your physiology, and it is unique how you will react to that. But it's always interesting to see so if you've had more stress on your heart, what that is actually doing.
9 p.m. Saturday.
Yeah, this topic is about convenience, right? And so for a lot of the time, we sort of expect the patient, we expect the member to sort of go to the care rather than the care coming to you. We have an Aura Advisor, which is an AI chat within our experience that allows you to have a conversation about what's happening with my data, to ask it questions, to get health advice. And we had this really interesting insight that most of those discussions were happening when a doctor's office is closed, right? Because that's where it's convenient. It's not convenient to have to book an appointment. For a lot of people, that's a long wait these days to actually get there, and that's another inconvenience. And then to be ready and informed in those 10 minutes to talk about all the things that you want to talk about. And you sort of come out afterwards going, oh God, I forgot to talk about that, and I didn't mention this one, and sort of now and then you have to wait till the next appointment. And so we had this insight, and what we believe is the more that we can make it less friction and more convenient for the member. One of the things that we recently launched with our new product in the last few weeks is actually a clinical interaction where we bring the physician into that chat, and the member can actually ask a doctor questions on their data and the things that they have concerns about and the ways that they can go about, like, what is the next step on that? Do I need to take action on a blood test? Do I need to take action on a scan? Do I need to take action on, like, going in person for a physical appointment? Or was I worried about something that I shouldn't be worried about, right? And so we've sort of tried to get to that point of, like, how do we get that more convenient way to bring the care to the member rather than expecting the member to go out and get that care.
Laura, just reflecting on what Dora just said and then maybe broadening it out, what do you think is the most frictionful part of healthcare today? Recognizing that we have innovators here, you're an innovator, a lot of problems are being tackled as we speak, but what's being overlooked right now?
I mean, I don't know if it's being overlooked, but the thing that sort of comes to mind when you said most frictionful, I was like, oh, prior auth. Yeah. It just comes, it's the immediate right off the tip of your tongue. Yeah. And it's interesting because in a lot of ways, it reflects kind of some of the paternalism that exists in healthcare, right? As we are going to tell you what you need. And it's this, like, conversation that happens about you and about your things without you in it, right? It's happening between, your health is about you, but it's between your doctor and your insurer. No one's telling you what's happening. And in a lot of ways, like, why am I not brought into this? Why is I not knowing the option? Why not tell me, okay, it would cost me this much. Here are my other alternatives. Here's the different efficacy, but let me make that decision. And I think so much of it is, it's paternalism in healthcare, right? I think, the history of medicine is very paternalistic. We've gotten a lot better, but we're not there all the way, and the systems kind of reflect that. So it's so much of it is us doing things to patients rather than doing things for patients. We need more servant leadership in healthcare, where my job as the doctor is not to, I don't actually know better than you, right? I may know a lot about the disease, but I don't know about your lived experience with it. And you're the one who has to make the decisions and go with that. So in a lot of ways, we should treat more of healthcare like that, right? You are in charge. My job as the doctor is to advise you, give you my opinion, help you reach your goals, motivationally interview you to get there. And if you don't want to listen to me, or you don't want to pull me in, that's fine. But we have all these processes where, the patient isn't even in the room, and I think we find those to be high friction and negative. And that's why, prior auth comes to mind, because I think it's the prototypical example of it.
Thank you. I want to just another. Oh, perfect. I see a gentleman here in the white cap, 4 rows in. Please do, raise your hand, taking questions all throughout.
I'm Kurt Malkoff. I'm a PhD clinical psychologist. Clearly, when you look at behavior change, you have to look at the cohort groups. You're in never land here. Everybody wears the wearables. Everybody eats well, what have you. How do you get this down to the real America? Because if you looked at who you sold these products to, I think you would see a skewed intellect, a skewed financial position, whatever.
So we do look at that, and that you are spot on. That is such a challenge, and I think you've got the right framing of how do we make this more accessible. You would actually be surprised to learn a little bit more about the financial ability, the equity on some of the populations that are actually using wearables, and specifically Oura rings. I think you'd be pleasantly surprised. But just putting that aside, what I think the biggest thing is getting access, right? And making it more affordable. And that to me is a challenge around business models. That is a challenge around working with payers. One of the things that we do today is we partner with a Medicare Advantage plan, Essence Lumeris, and we provide, it's to an over 65 population, but we provide Oura rings to them. What we're seeing in that data is that actually is improving engagement, it's improving health outcomes, it's specifically right now supporting them on overnight breathing disturbances in their sleep and linking that to comorbidities. Equally, we have a partnership with Cigna that we're doing something similar. And why are we doing those? The reason we're doing those is because we're trying to make this product more accessible. We don't think that sort of your quote unquote your payer dollars or the self-insured employer dollars should be limited to just sick care. They should be like pulled out to be more proactive. That's a big effort that we're trying to do right now.
And just if I can add to that, I do think, right, it used to be that I used to think that wearables was, it was the worried well and the worried rich, the Aspen crowd that really liked them. No offense, guys, but so I'm on the board chair of Sanford's health plan. Sanford is the biggest health system serving kind of rural America. They're really at the forefront of sort of driving that work. I also was an early employee at a company called City Block Health, which is focused heavily on the underserved populations, both kind of urban and rural throughout the nation. And I think we saw in both those populations that kind of the adoption of these models, the adoption of these tools. It's not always rings. Sometimes it's it's scales, it's kind of blood pressure cuffs, but the same models of one being able to center them in their care and giving them the kind of tools, be that hardware and software to kind of manage that we actually saw the same effects where people loved being able to have those tools. They loved being able to kind of engage in their health. They actually enjoyed being able to have the data from their blood pressure cuff and sort of get it via SMS. I think I saw in both the rural and urban populations that the macro principle rang true. It had to be accessible to them in terms of both cost and integrated with their healthcare systems. Once they had the tooling, they leveraged it to the same degree that the higher income patients did.
And can't talk about cost and affordability without talking about pharmaceutical innovation. Mm-hmm. And I think it's important to note that I won't sit here and presume to say that the self-pay price that we launched makes it affordable to every American that is diagnosed with a chronic weight management and is prescribed a Lilly medicine. But when you reduce the cost and the sort of in the traditional model, when your list prices are $1,000 or more, and your most underserved patient population, Medicare, Medicaid, they don't have commercial coverage, or you do have commercial coverage and you're paying your insurance costs and you're denied coverage because, well, there's a lot of friction, or you have coverage and there's all the prior authorizations, you don't meet criteria. There are so many things that have to go right for you to get access to the lowest out-of-pocket cost you are eligible for. So taking that $1,000 list price and reducing that cost down with a transparent cash price to consumers absolutely opened the door for more Americans who have obesity, who are diagnosed and prescribed medicine, to get access to that medicine. Interestingly, what we see through market research, it's not just the most affluent. It's people that make trade-offs in their day-to-day lives, that are thinking about where they spend their money because they believe that this has the potential to help them get better. And so people are thinking about that money. Now, how we make it even more affordable, more accessible, we're really excited about what's around the corner July 1 with the CMS Medicare GLP-1 Bridge program. This is, I think, an innovative approach. It's an 18-month program, but it's an innovative approach to see how we make medicines more accessible to more Americans, again, particularly those that have historically not been able to access pharmaceutical manufacturer affordability programs because regulations were such that you can't offer it to anyone who's a government beneficiary. So this is an opportunity for people that are diagnosed, who meet the criteria, to pay $50 a month for medicine when it's right for them. And I think that continued innovation, and that was the federal government. The self-pay channel was a pharmaceutical manufacturer. We'll continue to partner closely with the traditional insurers and the PBMs. Lilly announced recently an Employer Connect program to really offer employers not just the traditional PBM option, but alternatives to that to try to make medicine more affordable for them, but also to create transparency in where the money's going. It's going to require that kind of innovation across the ecosystem to ultimately reduce cost and to help more people be able to access them when they believe it is right for them.
I'm going to come to, I see a few audience questions, and I'm going to come to you in a second. Can you, Jen, elaborate on Employer Connect? What does that mean for the employed American that might participate, or their company might participate in Employer Connect? Does that take some of the complexity out of getting a JLP, or can you elaborate?
The process will be the same. I mean, the realities are you're commercially insured, you're an employee, you saw your doctor, you were diagnosed, you got a medicine, you went to the pharmacy, and you were told a prior authorization is necessary. Or you were told it was denied. And then oftentimes, I know we get a lot of feedback from healthcare providers. They're so frustrated because the patient believes it's their fault. They must have done something wrong. They didn't submit it correctly. They weren't fast enough. And it's almost as if it was designed friction and somehow so complicated to understand. Again, we've been in the market for 150 years, and we've learned so much in launching Lilly Direct and going direct to consumers. Things about the way we thought the healthcare system was supposed to work that was still so fragmented and broken. And so we launched the self-pay channel in August of 2024, and since we have dispensed over 11 million prescriptions to over 2 million patients in the United States. And that's exciting, but there are so many other people that could be taking advantage of these medications when it's right for them. And sort of the unlock was, again, this idea of consumer transparency and consumer empowerment. And this idea that consumers are going to stand by and just accept the continued friction. I think that we're going to see that continue to change. This is a really interesting moment at a scale that we can't ignore. So in addition to that, as Lilly continued to work with the traditional PBMs, Lilly decided that we talked to a lot of employers, and they were absent the same level of transparency and the amount of money that they were spending. Their employee base was frustrated with the utilization management criteria of those particular plans. And so they just wanted an alternative. And so Lilly launched Employer Connect, which is an opportunity to engage with program administrators and pharmacies with access to certain price points to Lilly medicine, where it's very clear. It's a one-page, here's the price, here's what it is. The PAs are PA to label, so you don't have all this added utilization management criteria on there. And it's just another tool, really in the toolbox of trying to help more people access the innovation when it's right for them.
That's great. I'm going to thank you, Jen. We have a question at the very back of the room. Perfect. Please.
Yes. Hi, I'm a physical therapist based in New York, and my patient population is exclusively Medicare 65 plus. What I'm noticing with wearable technology is that it's limited to physicians, PCPs, but your specialty providers are spending more time with these patients, and we can actually use it in our plan of care and show you outcomes that our interventions are working. So how does specialty care get involved, and how do we move beyond PCPs?
That's such an excellent point. I would love to hear from you, your ideas on how to get more involved in that. I think we're still in the early innings. I think wearables have gone through sort of like a lot of shifts. So the early days of wearables was counting steps, which was sufficient, but it wasn't really moving the needle on health. And then the next iteration of wearables was really about connectivity, your text messages, your phone calls, connecting to your calendar. And the next arc of wearables is really about moving beyond wellness and into clinical care and being able to measure those outcomes. And, I think about this all the time, but, clinical measurements and clinical grade quality doesn't have to happen only in a clinician's office, right? It happens all the time, every day. And so I think we're still in the early innings of what that can do, but totally agree with you that we could go beyond into more specialty care and use that specifically for behavior change too. One of the most powerful things that we see with Aura data is people who wear it and they start to change their behaviors because they start to see this virtual loop. My favorite one, I'm from Ireland originally, and we get stereotyped on drinking too much alcohol. So if you want to pile on board, just I'll welcome it. But one of the hardest
behaviors. You from Ireland?
I know.
I couldn't tell. I couldn't tell.
But one of the hardest behaviors for people is to change their relationship with alcohol, and it's actually one of the biggest changes that we see when they start wearing an Aura ring, because they start to see, I am like one of these people, that it impacts me for 3 to 4 days afterwards. So not just I feel, can I swear? Of course I can, I'm Irish. Not just that I feel shitty the next morning, but I actually don't feel right for a few days. And how do you change that behavior? Well, people start to either reduce, some totally eliminate. They change the time of day they drink. They change the amount that they drink. They change when they have it with food. They change the amount of water that they have with it. And they start to see the data change. And so, if you ask, 75% of people typically know what healthy looks like. They know that sort of general guidelines, but they believe they almost defy it, or they believe that it doesn't apply to them. And when they see their own data and they see that change, that's when the behavior change. I think it's way more powerful when that is in concert with a specialty service, with a clinician, with a physician who's actually with you on that journey. That's even more powerful.
And I think to that, because I think the point you brought up of it should be specialists and it should be a broader range of clinicians, right? It should be your physical therapist, it should be your therapist. I love that. The other thing I would say is, there's no need to ask for permission either, right? I think, the device, the power of consumer devices, they are out there. You guys can integrate that into your clinical practice now. When, there are tools that can integrate it, there are tooling now, you can likely find folks who can even build ways for you to sort of build that in yourself. I just think that's available currently. We have a company called Cadence, and Cadence works with a lot of primary care physicians, but also they work with cardiologists. And what they do is, they don't make the hardware, but they deploy hardware to exclusively seniors. So they work with only folks who are over 65, and they send the hardware to those folks' device, and then they integrate with doctors' offices. So they're in what I think it's now 7,000 sites of care nationwide now, and they work with them, and their AI tools monitor all those fluctuations. If someone's heart rate goes up, if blood pressure drops, they will change the regimen. They will notify the physician, and they've done randomized controlled trials that have shown that it's saving Medicare now, $1,000 per member. I think that averages out something like $2 million a week that Medicare is saving from their program. So I think they've shown that these interventions, marrying the wearables with the clinical care, and both primary care and specialists, are having real effects and having real outcomes in published studies. So I think your push is right on seniors plus wearables.
Awesome. We got a lot of questions coming now, and it's just welcome. I think we have one here. That was the first hand I saw. Lots coming up. Also, folks, feel free to come and take a seat if you want to be more comfortable.
Hi, thank you very much. Dorothy, thank you so much for the Aura ring. I have mine.
Oh, good.
And
hope your scores are good today. Are they okay, your scores today?
Yeah. My scores are great, actually. And I'm an example where I'm a sleep apnea and insomnia patient, and actually seeing the data every day actually also helped me realize how eating late and drinking, even just 2 drinks now, was disrupting my sleep, and I could see it in my sleep stages, and I would take a screenshot of it and throw it into Claude, and then Claude would interpret it for me.
Yes.
And then I had this whole track record with Claude. But, so I have a question for all 3 of you, kind of a thought exercise. So we manage sleep apnea patients on CPAP machines, thousands of them. We use agentic AI to do that. We connect to their CPAP data. And what we're seeing is that patients that are on a CPAP machine with a wearable, any wearable, their adherence improves, which improves the provider's reimbursement economics as well as ResMed's reimbursement or revenues from selling more devices, more masks, et cetera. But they also want to get on GLP-1s. And so our customers are now coming to us, and our patients are talking with the AI system. They're like, oh, I have insomnia, or like, how can I get a wearable? How can I connect my wearable data to this? Or how can I get a GLP-1? And what I'd love to hear from you guys is like, what, if you could wave a magic wand, what would be like the desired experience from like, hey, I'm a patient who may not know I have sleep apnea. I discover it through Oura Ring. How do I get into clinical care? Then once I'm in clinical care, how do I get my sleep doctor, who I think are actually one of the first specialists that could use this data? And they've been asking us, how can we get wearable data so we know more about our patient's sleep? But then how do you manage multiple therapies when they want a GLP-1? So anyway, just curious to hear from you.
That's a great prompt. Do you want to know Jen, Dora, and Laura?
First, I love magic wands. I say it all. I'm like, if I had a magic wand, this is what I would do. I think it is a really good question. And again, it goes back to it is incumbent upon the individual person to figure out how to connect all of these dots and navigate. And the magic wand world, both in the data accessibility, the quality of care at my fingertips, the ability to get authentic medicine, price it, and the integration of all this, it really, I think it's how do you continue to create that agency for an individual person, but doing so where all that data is sitting in one place, and then you've got this sort of magic wand, beautiful digital experience where it's 24/7 accessible. But if you take all the parts, minus the magic wand, you take all the parts as they exist today, consumers are taking that data. They're now trying to identify, is there a specialist or someone I trust that I can go see that maybe even is accepting of the data that I'm handing to them? Because not all clinicians know how to interpret the data or really value it at this stage, right? So it's finding that right partner. And then it's getting to the right diagnosis and the right medication, right? The whole gamut. But I think it really comes down to like, is there a platform in which the data is connected, the consumer is sitting in the driver's seat and raising their hand for access to a quality care provider that's been vetted. A space to have the conversation with the care provider that still respects the independent nature of that care provider-patient relationship. I think that is so important that continue to be maintained as independent and sacred as people are making decisions about their bodies. And then with that, again, the ability to no prior authorizations would be a phenomenal world, access to transparent pricing, and then the opportunity to leverage the data in a way that shows maybe before you're really seeing sort of the outward signs of, let's pick on a GLP-1, of weight loss or whatever that is, you start to see some of the biometric data that suggest this is starting to work for you, which is what really leads people to say, I'm going to stick with it. I'm going to dose titrate, right? And then once you sort of get that cycle, that positive feedback loop, and you see that cycle, and that's what really drives the persistency and the adherence. And then no one else telling you later on, we're so sorry, you've lost coverage. And now you got to pay $1,000 again. Don't let that be the reason why people can't stay adherent to medicine. Those are some of the stories that we see. We see people both in the self-pay channel say, I just can't afford this anymore. So to the gentleman's point, that is still very true. And then we see people having to stop medicine or switch a medicine that was working for them because someone in the healthcare ecosystem told them it was no longer the right thing. We got to get rid of that.
I'll say for the record, I don't, I think prior auth has a role. I just think the way we use it currently is flawed. I just want to make sure I clarify there. But I think to your point, we live in a time of magic, right? Like we live in a zone of Hogwarts right now, right? Like as they say in tech world, you can just build things, right? And I think that applies to health now. You can get the data from your wearable. You have access to these AI tools that can interpret it. You actually don't have to wait the 6 months to get an appointment with your with your sleep doctor to understand what is likely happening with you. And I think that's magical on its own. But to your point, so we live in this time of magic. The barrier now is how do we make sure that you can access and afford the medication, diagnostic tests, or device that you need to hopefully fix whatever problem you have. But the upstream is there. And I think in a lot of ways, you don't have to wait for permission from the system. People are giving you access to hardware and tools that can let you actually solve it yourself. We can build these things and build these experiences for ourselves and our loved ones.
Wow. All right. We're going to I'll try to be geographically balanced. I know we have the mic over there, so maybe over there, gentleman with the glasses on his head.
Hi.
Can I just ask, just to get to as many questions as possible, can we just direct it to one panelist?
Sure.
Okay.
So this is a question for Jennifer. I was just curious, with this partnership, would you say that it sort of notes and acknowledges the criticality of behavior change alongside the medication? And I wonder if you can comment on that.
Absolutely. I mean, Lilly has spent a significant amount of time over a number of years looking at really behavior modification that goes beyond just the point of prescription and sort of that decision. Even in a lot of, clinical trial protocol, it's fairly much in a vacuum, but if you look at even study protocol, if you look at it with GLP-1s, there was a layer of diet and exercise that sat on top of the clinical evidence. So it does suggest it's not just the medicine, there is value in some of these behavior changes. However, don't make someone go through 11 cycles of diet and exercise before acknowledging that there's a biologic reason that they should be on a medication that can help address what's going on in their bodies. So the crux really in sort of our regulated system is to be really thoughtful about how you could sort of conjoin the medication itself and then the opportunity for other holistic health resources around sleep, nutrition, movement, well-being, stress management, meditation, the biometric data. But in our world, doing so in a way that doesn't start to make sort of a claim of efficacy or safety, right? There's always that balance, which is where the power then becomes not from the pharmaceutical manufacturer touting some big claim on a commercial. It comes from the individual starting to see the changes associated with the medication and lifestyle changes, holistic health that sort of wraps around that. So the partnership with Aura, I think, is indicative of the journey that we've been on and what we've launched with Lilly Direct. We've talked a lot about Lilly Direct and the pharmacy and the self-pay channel, but we have a lot of resources available to consumers on Lilly Direct where no prescription's necessary. That is an option for you, but you also have access to Thrive Global resources, nutritionists, independent care providers if you're looking for quality care and then don't have access to one. And then now access to a free Oura Ring sizing kit just to see and sort of explore more if that might be right for you.
Awesome. Charlene, I see you here in the front row.
Yeah, so I'm a pediatrician and a mom, and my question, maybe Dorothy, for you is, it's great to establish these healthy habits as early in life as possible so we don't actually have adults that need a GLP-1, for example.
Sure.
Question your thoughts and Aura's approach and or other wearables to thinking about, for example, teenagers.
Yeah.
And how should we be thinking about when they're developmentally ready to get these type of data back?
Yeah, this is a tricky one, right? Because there's a lot of vulnerabilities with technology with children. So we are not proactively focused on sort of younger teens or children. So I just want to be explicit on that. That said, there are really interesting pieces of biometrics that I think are really interesting to study. So I have 2 daughters. They're right at the age where they're going to be starting their menstrual cycle. And I know there's plenty of females in this room, and maybe you can kind of nod along with me on your journey, but this is this blind sort of certainly in my generation, more of a taboo topic that never talked about it. One of the things that I'm most proud of that we measure in Oura Rings with a great degree of accuracy is your cycle. And so you think about young teenage girls who are going through that journey and having an actual forecast of what's happening in their cycle, and then to understand their physiology changes that are happening. Why do I feel this way at certain times of the month? Why is sleep changing? Why is stress levels changing? Why do I feel more energy at certain times of the month? That is an incredible tool that you can harness and sort of to make it a superpower almost. So I think about certain ways that we would measure it. Same with sleep. Sleep disturbances in kids who are then translate into learning difficulties, and often they realize very early on that they had a sleep apnea diagnosis, but again, they kind of get overlooked in that segment. And so I think there is a world for wearables within that population, but we have to be really thoughtful. We do not need more screens. We do not need more technology for those individuals, and so we have to be really thoughtful how we bring those things to market.
Fantastic. I'm going to go to the back now. Gentleman in the green shirt.
Hi, this is for Jennifer and Lilly Direct, and maybe bigger. With people buying peptides in the gray or black market, to me, it's a lot like early days of broadband internet with people downloading illegal music. And I think we saw with Apple...
I get it.
Well, people don't want to be criminals, right? Like,
Yeah.
we saw with Spotify, with Apple Music, if you have an easy way at a good price, people prefer to pay. They don't want to go to Kazaa or LimeWire
Right.
or Telegram. They'd rather come to you, know the provenance. So what is the evolution required for something like Lilly Direct to be the Spotify of that space?
Yeah, I think, thank you. I think you make an important point that people, and your analogy was don't want to be criminals. I would say people really aren't signing up to put foreign substances into their bodies. So I think it does start with, if nothing else, consumer transparency, and I'll say that transparency and agency, to be very clear that when someone is seeking for better health, weight management, cardiometabolic risk reductions, that they know what they're buying. And in a lot of cases, they know they're getting access to something that is touted as a GLP-1. They're getting it at a lower price point. It is not clear where it's coming from. I can tell you it's not gone through quality manufacturing rigor. The amount of rigor that goes into being able to bring a pharmaceutical agent to market, even after it's gone through all the clinical trial protocols, then on the manufacturing side, it's pretty miraculous that you can move with such speed to get medication to market. So I think that if nothing else, we got to be really clear and transparent with consumers what they're putting in their bodies. But the important point you're making is what consumers are saying is they are raising their hand for help to get better. And that starts with access to quality care providers. It's access to FDA-approved, authentic medicine that's been clinically trial tested and manufactured in a way that is safe for them, at least on the manufacturing front. I say safe because all of these medicines have a benefit-risk profile that you have to consciously be aware of, and that's something that's really important for you to consider with your clinician. And at a price point that I can actually enter into the game. And so I think what we've talked a lot about here is that's traditional commercial coverage. I mean, if you are an employee and you have commercial insurance and you're paying your premiums, the pharmaceutical companies, by and large, if you go to any medication, there's usually a copay card that you pay as low as a $25 copay or whatever it is. You just got to get the prior authorization approval to be able to access it. But while that is sort of catching up, and that we can create more and more accessibility through the traditional model, the innovation around self-pay channels, price points that are more affordable, not affordable for everyone, more affordable for more people, things like what CMS is doing with the Medicare GLP-1 program, again, it's going to require those type of innovations. But you do see more people raising their hand to access this innovation. And I think as we continue to advance scientific innovation, there's so much cool stuff that is underway in scientific advancements that I think Lilly's really proud of and really excited about. I've spent my last 10 years focused on how I help people access that innovation, and it's been largely stagnant in how we bring medicine to people at a price that they can afford without significantly overburdening their healthcare provider. If I had that magic wand that we were talking about earlier, yes, continue to innovate, but let sort of this access affordability space keep pace with the innovation in science. So it's not a perfect answer to your question, but we certainly acknowledge, and we've been very vocal about ensuring that everyone is held to the same standards, and not only manufacturing of medicines, but in the disclosure to consumers what they're putting in their bodies. People should know it. If it's compounded, it's one thing. When it's black market, when you have medicine that's not even FDA approved yet, that people are accessing, that's insanity to me. And I think consumers should know about that.
Laura, I just want you to jump in here too. You led the team that built virtual care at Amazon. When you hear about these analogies to Spotify and Netflix and how we're changing healthcare consumption, what are your thoughts?
I mean, I love the analogy. I love the idea of how do we create new ways to access medications. I think a lot of what these guys did was business model innovation, which I think is part of access, right? That's how we get that innovation. And I like your point on, folks have a need. I just think it's for a lot of what we did at Amazon Clinic, it was saying we need to figure out quicker ways for people to access the medication. So it was in essence a direct-to-consumer channel that was on Amazon to say, you want these medications. These medications are fairly safe. There are a lot of conditions out there where it's what your need is. You should be able to then get you access quickly to a doctor who can get you access to that medication. And I think the ways in which we change the channels by which we access it, we should be free to innovate there. But to your point, there is also a line around the safety of the sort of substances, right? We should let people access things that we know are safe. If they're not safe, there should be some lines drawn on accessing, X peptide from China that no one's tried before. So I agree with you on that.
Awesome. I'm going to try to get to at least 3 more questions. Then can you guys stick around after to have conversations? Great. Laura here in the front row. Yeah, actually we have a mic coming right here. Thanks.
So I'll try to make it quick, and I'll do it for you, Dorothy, because early adopter of Aura, I have the lifetime membership.
Awesome.
So that's very
Lucky
cool.
you.
Yes, and an early adopter at the stage of step count, the evolution. Awesome. So I have been watching how you go from a consumer product crossing over into a medical device, because as a physician, I always said, okay, but you're doing biometrics. I mean, how can you tell me heart rate and all these things are not medical? My question for you is, because I'm very excited about how that happens and how it gets into the clinical care side. But I'm also interested in this idea that 80% of traditional healthcare outcomes are determined by things outside of the traditional healthcare system. And I know on the app, and you can tag what you've done or what activities and things, but what do you see coming as opportunities to more formally integrate? I liken it to, yes, you could scan a PDF into the EHR and include social determinants of health, but what's the evolution towards making it more of an integral part of factoring those things into the biometrics?
Yeah, so a few thoughts. Well, first of all, thank you for being such a long-time member and believing in it. I think a few parts. One, the first part is we measure data, right? And that's good, but it's not sufficient. The next is actually giving you insight in what to do. And then the third part is taking action on it. And a lot of our strategy revolves around this kind of connected care strategy. And you kind of said it well earlier on the sleep apnea example. But the ideal scenario, magic wand scenario, is that your wearable data, your biometric data that's continuously measuring longitudinal data across a number of things, from your heart rate to your overnight blood pressure to your mapping that. We actually map that to your lab panels. If you want to sort of get a lab panel in Aura today, you can. And that all flows and connects where you want it to connect to where you're getting care. And I think there is a moment with AI right now that this actually becomes possible. And I think as long as the member has agency over where that data goes, they control it, it's their data, it shouldn't be sold, it shouldn't be used for adverts, it shouldn't be something else. It should be just very clearly going to their physician and connecting there. That's where I think it's useful.
What about the data coming in? Like a broader range of
Sure.
data that
Yeah.
those?
Yeah. So there's we're working on this, and we are certainly in early stages of it, but a few examples that I just mentioned. So we have a partnership with Quest Labs where you can actually purchase your lab's data and you can actually connect those with your Aura data. So you can start to see that your behaviors are affecting, say, a lipid panel that you might be working on. We have the similar thing with Dexcom CGM sensor that we actually integrate that into the Aura experience and you can see that. More and more, we're going to sort of be bringing that data in to give context, right? So that you can actually align your daily behaviors with your long-term health outcomes yourself. And you can do that yourself right there. So I think you're right. That is the direction of where this is going, and it's a good push. Thank you.
Great. I think we're going to go to our gentleman here in the white or vanilla.
We're going to go right here.
And then we're going to go right there.
So I'm like, I don't see it.
And then we're going to go right there. We're going to do last word there.
There you go.
Thank you. Another question for Dorothy.
Sure.
There's no doubt that these wearables allow patients to just totally take charge of their health. But to play devil's advocate for a second, is there any conversation going on about optimization culture and how these rings and wearables can actually adversely affect patients that get them? They're worried about closing their rings. They're worried about their step count, things like that. Is there any conversation going on about that?
I think you're right. Look, data for the sake of data and data overload, it's, I think that can be a challenge for some people. To me, it's a design challenge, right? I don't think what is useful is giving people insights that they don't need, right? And so you should only signal things that are actually valuable. So I'll give you an example of one of the things. First of all, we don't have a screen, very much by design on Oura Ring. It should be there in the background. It should be proactively messaging you when something is off. So we measure overnight sleep disturbances. And what we do, instead of giving you like an absolute measurement, we tell you what's happening over a 30-day trend. And we only signal to you if something is off and that you should take action on that. So we're not sort of feeding into the psychology of you should be worried about this all the time. The proactive and prompting should only be when it's necessary. I think it's a really good push, and I think we're not at the point where that is a massive problem yet, but it's a good one to keep an eye on.
And by design, we're going to go to Tia for the last word here.
Yes. Thank you. I appreciate that. I really do appreciate that. My name is Tia. I'm the owner and founder of Polar Nole, a hair care and wellness brand. So I'm coming from a different perspective, and that's why I really, really wanted to ask my question, because I'm not coming from the perspective of accessing medicine. It's more so gathering the knowledge of the biometric data. I'll just ask my question, I'm sorry. As biometric data becomes more central to preventative health, how do you see, well, it would have been to both of you, but I'll end it to you. How do you see visible and lived health signals, like changes in hair and skin, being integrated alongside the wearable data, and how does that influence the way you evaluate businesses operating between traditional healthcare and consumer wellness that translate data into everyday behavior change?
That is a great question. Great question. And I'm going to say great question 3 times to give myself time to process it. We're big investors in OpenAI. And I think, in our work through them, and I've partnered pretty deeply with their health team, that's really helped me think a lot about how do you, because one of the things is they partner with a lot of sort of data sources, right? They partner with a lot of data sources. They also service a lot of data back. I think it's helped me really understand and kind of broaden my perspective on, what actually counts as a biomarker. So part of it is, to your point, there are things that the healthcare system traditionally thinks of as biomarkers. I think there are folks who have really expanded our definition of what that looks like, and I think you guys have done a lot of that. That there are a lot of markers we hadn't thought of. And to your point, there are things in, the lifestyle kind of wellness space. I would say just, human markers that actually will tell you and are also valuable signals. So how do you actually start to bring all of that in and kind of integrate it forward is super important. I think we've been working a lot with their team to actually understand, how do you get signal before signal has been studied? Because we're in this age of rapid data in which we are going to find years from now that, things that we did not know had an effect were sort of critical. And part of it for us as investors is as we hear about these companies, there may not be a randomized control trial that shows that, X biomarker is predictive. There may be, early signal, right? There may be real world data, and real world data in both the, science pharma sense, but also real world data in the sense of, you have collected kind of deep anecdotes and you have data from your usage. Your company may be doing it. What Epic and Cosmos is doing is its own kind of version of real world data where there's the kind of lived experience of what people had. And I think we're still learning how to process that as both company builders, but also as investors, and saying people are bringing things to us that are novel. How do we double down and know to kind of invest in it? This may not be accepted today, but will be accepted tomorrow, because a big part of our job is to back things for the future. So not a clear answer, but know that we are thinking about the fact that if we've learned anything in this period of AI change is that we're all Jon Snow and we know nothing. So therefore, when people come to us with new biomarkers and new ways, but winter is coming, right? With new biomarkers, we need to accept that.
Yeah, for sure.
Before winter gets there. So
yeah.
That's kind of bridging that gap to fill in that space to get more. I think it's kind of underrepresented. I just want to try to get
A wide open space. You mentioned clinical trials. Like, it's difficult when you start to get into patient-reported outcomes. Quality of life metrics are just largely not acknowledged in clinical trials, and they certainly don't make their way into at least U.S. FDA labels and what you should look at. And then they're certainly not valued, if you will, from a payer perspective. So we'll continue to innovate science, but I think that there's this really cool opportunity to wrap around beyond just, blood pressure, cholesterol, some of the cardio. What are the quality of life metrics that are being impacted through like this very connected system, and how do we start placing value on that quality of life? And I think that's where, beyond the pharmaceutical manufacturer, beyond the healthcare provider, like connecting those dots, I think could bring a ton of value.
And I think I'll say, because there are a lot of patient advocates in the room, and I think we're all advocates in our own way. If you want us to do these things, you have to make us, right? Us being, the FDA, us being the investors, us being the company builders. If you want us to value your lived experience, right, your report of what matters to you, your outcomes, your experience with these diseases, and these are things that we should measure and count to the same degree we count the hard clinical metrics, you have to say it and you have to make us do it, because we often will not do it on our own, is the history of the healthcare system.
I'm going to keep us on time here. Thank you so much, distinguished
you.
panelists. Thank you so much. Thank you for your questions. Awesome.
Thank you.
I know you got a flight to catch.
I got to rush. Thank you.
Awesome job.
Thank you.
Incredible.
Really appreciate it.
So well.